And I believe this is the one I want. Yes, it is. I'm reaching back. I'm going back way far back to talk about the skeleton here. So we're now moving on to some of our organ systems, and believe it or not, your skeletal system, all right, bones are an organ. All right, like your liver is an organ, your pancreas is an organ, your stomach's an organ. Well, guess what? Your bones are an organ. And so we're going to go through a somewhat challenging part of our class, and we're going to learn about the bones of the skeleton. All right, for the lab portion, we're going to be doing a lot of identifying of the different types of bones. We're going to break down the skeletal system into two sections, the axial skeleton and then the appendicular skeleton. All right, just a couple facts here about our skeleton. Okay. And we talked about some of the functions of bone, right? A couple is listed up here. Okay. So the bones of our skeleton are going to help support some of our soft tissues. Well, what does that mean? Well, some of our soft tissues will attach onto the bones or attach to the bones to offer support and keep them in certain places, right, where they shouldn't be. So they're not just all sloshing around or sliding where they shouldn't be. All right. Protection is obvious. All right. Parts of our skeleton, like your skull, your vertebral column, the spine there, are going to protect your central nervous system. Right. Your rib cage in the sternum helps to protect your lungs and your heart. Parts of your pelvis will help to protect some of the organs found, right, in the pelvic cavity there. Yes, our skeleton is designed for movement because our skeletal muscles attach onto it and they create levers for actual motion and movement, but also it's going to be a weight-bearing structure. We are designed to bear weight. We're not designed, all right, to be sedentary or inactive. So great statistic, not a statistic, but a great fact to ask people is how many bones are there in the body? And that's 206. And so we're going to go through all these different bones here, all right, or most of them. All right, and we're going to discuss some of the features and the characteristics of these bones. All right, so as we're moving through this chapter, you're going to see when you're looking at some of these bones that some of these, the bones will have these markings, these surface markings, okay, certain features. You'll notice that there's indentations in some bones, that there's holes through other bones, and how there's projections that come off. All right, so we're going to talk about the significance of some of those. All right, so where you'll see like bumps on a bone, all right, we give those special names depending on how big or small the bumps are. But those are going to be sites of attachment, okay, for muscles, tendons, ligaments. In some of the smooth areas of the bones, all right, you're going to see that's where we're going to have articulations, or basically what we call joints, right? And of course, smooth areas are ideal because ask yourself this, all right, would you rather have two bones rubbed together over a smooth surface or where both surfaces were rough? You want the smooth areas, less friction. Okay, so we're going to go through a bunch of these different structures here. I am going to encourage you to go into chapter 8 and look at figure 8.1. And you're going to see, all right, you're going to see this chart here, this table, excuse me. And it's going to have, all right, the anatomical term and then the description of those terms. Now, as we move through and I start to talk to you about some of these structures, you're going to learn a lot of these just from me just kind of describing them to you and pointing them out. But it will help if you go through and just glance over this chart and try to learn, right, some of the definitions. So when you hear me talk about the head of the humerus, then you know it's one of the ends of the bone, all right, specifically the proximal epiphysis, right, that is going to attach to a proximal portion of the axial skeleton, right? Or when you hear me talk about a foramen, well, then you'll know that a foramen is a space or an opening, a rounded passageway through a bone. So these will help to articulate, all right, a better understanding of these structures that I'm mentioning. And it has pictures here that you can look through. So I really encourage you to look through that. All right, so today we're going to talk about the axial skeleton. Like I said before, we're going to break down our skeleton into two parts or divisions. The axial skeleton, which is basically everything along the central axis of the body. So that includes the skull, all right, your vertebral column, your spine, and your thoracic cage, which includes your ribs and your sternum. Okay, so that's the central axis there. And so we're going to see in this portion of the skeleton a lot of protection functions occur there because, like I mentioned before, your skull and your spinal cord and your vertebral column protect the central nervous system, right? But and also we'll see the thorax, the rib cage, protect the rib of the lungs and the heart. So we're going to see all of these functions here. We'll also see a structural framework in which we're able to attach other tissues to. But the axial skeleton plays a huge role in the process of hemopoiesis. All right, and hemopoiesis, I mentioned it before in lecture, is the process of making the formed blood elements. What does that mean, Dr. Kaz? Basically, what I'm saying is the spongy bone and the axial skeleton is going to make your red blood cells, your white blood cells, and your platelets. Why didn't you say that? I just did. Okay, that's what we're talking about. That's hemopoiesis. So here's the axial skeleton. You see here, it's everything that's in this in blue or teal. I guess that's teal. All right, the skull, the spinal cord, and then excuse me, I keep saying spinal cord, and the vertebral column, and then your rib cage with the sternum there. So it's the central axis of the body, the central portion. Everything else, you know, attaches onto that part. And then everything that's not colored, that's the appendicular skeleton. And we'll talk about that. So what's the appendicular skeleton? That's basically your upper and lower extremities and the bones to which they attach to. And we call those girdle bones. All right, so where your hip, your leg bone, your femur attaches to your hip, all right, that bone is called the os coxa. So the os coxa, your hip bone, is part of the appendicular skeleton. So when we're talking about the hips and the lower region, that's the pectoral girdle or the pelvic girdle, and that's going to be for the lower extremities. And then the upper extremities are that's going to be the pectoral girdle. We'll talk again. We're going to review all that when we do the appendicular skeleton. So don't worry about the material too much right now. All right, so there you can see there's the appendicular skeleton, everything that's colored in teal there. So your upper and lower limbs, and then the bones to which they attach to. All right, again, you can see, all right, this table here, figure 8.2 is showing you all the different bones and to which skeleton they belong to, the axial skeleton or the appendicular skeleton. All right, so what is the general function of the axial skeleton and what bones are considered part of the axial skeleton? It's going to create the framework for support and protection of the organs there. All right, real simple, skull, vertebral column, and the thoracic cage. So we're going to start going over that today. So we're going to talk about the most complex part of your skeleton, which is the skull. All right, 22 bones, quite a few. And so we divide those 22 bones into cranial bones and facial bones. And I think that's pretty self-explanatory there. Facial bones will make up the bones that make up your face. The cranial bones are going to be the remaining bones that are pretty much going to create the part of your head that houses your brain. All right, so all these views that you're seeing right here, all right, are the different views of the skull that I'll be going through. So this first one here, all right, that is an inferior view. We're looking up through the bottom of the skull. Okay, then as we move across our screen here, you'll see we have frontal view or an anterior view of the skull. This is a lateral view of the skull. Posterior view, the back. Superior view, we're looking down at the top. And then this is a sagittal view. We've cut the skull open and we're able to look at the internal contents there. So you need to know all these views here when I'm referencing it. You should be familiar with that. So let's start off with the cranial bones. These are the bones that are going to make up the structure called the cranium. And the cranium is going to be the part of your head that surrounds and encapsulates your brain. So if I were to cut off the top of your head, right, I would be removing the roof of the cranium, and we call that the calvaria. And so now part of that is made up of your frontal bone, and we'll go through all these bones here. The parietal bones, which sit on the side of your head, and then part of the occipital bone, which is the bone on the back of your head. And then the remaining portion of your skull, all right, that is left behind would be the base. And it's made up of the ethmoid, sphenoid, occipital, and temporal bones. Again, we'll go through all these. So here you can see, all right, here's the skull. We've just removed the top portion of the skull. All right, that's the calvarum. Here's the base of your cranium, and your brain will sit right inside of here. These are both superior views. We're looking down on top of the skull. So this bone up here, you can see the suture lines. That's where the bones have fused together to form a joint. All right, this is the frontal. Then you have your two parietal bones. And then way back here is the occipital bone. Again, don't worry if you don't know that. We're going to go through all that. All right, so the other category of bones of the skull are the facial bones. All right, so again, like I said, these are going to be the bones that make up your face. And so they're also going to serve, all right, as a protective function, all right, for both your mouth and your nose, or the digestive and respiratory systems here. And so everybody's facial bones will have a lot of similarities, but obviously there's going to be some differences because obviously we don't all look alike. All right, so we're going to talk about, all right, when these facial bones and their locations, how they're going to form certain structures. For example, your eye sockets or your orbits or your nasal cavity. There's several bones that make up the nasal cavity, all right? And so we're going to talk about all that. So you have 14 facial bones. This is an anterior and a lateral view of the skull. And so that includes all these bones up here, all right, and then off to the side here. So we're going to talk about all those. All right, so our facial bones, all right, aside from the fact that they are establishing a place for your teeth to reside, again, bones are supportive structures and they offer sites of attachment for ligaments, tendons, and skin. So the muscles that are going to be all over your face, you have two types of muscles, muscles for facial expressions and muscles for mastication. Muscles of mastication are the muscles that you use while you're chewing food. So these facial bones offer attachment sites for them. And so there's 14 facial bones, and we have paired and unpaired. All right, so you can see from our list here, the paired facial bones are the zygomatic, lacrimal, nasal, palatine bones. Those have to do with your nasal cavity and parts of your mouth. And then you have the inferior nasal concha and the maxilla. And then our unpaired bones are going to be your vomer, and your vomer is going to help to make up your nasal septum and the mandible, which is your jaw. All right, so let's start off by talking about some of the spaces, the cavities of your skull. So the endocranium, or the cranial cavity, this is the area that your brain is going to be residing in. It's the largest cavity of the skull. All right, so you have your cranial cavity. You have your eye sockets or your orbits. That's another cavity. You have your oral cavity, essentially your mouth, your nasal cavity, and then the cavities that like to give us problems during allergy season are the paranasal sinuses. Paranasal sinuses, all right, create basically a sinus in the skull is a space inside of a bone. And besides giving us awful time during allergies, it actually makes our bones lighter, makes the skull lighter, because instead of being filled with bone tissue and all that comes with that, it's now filled with air. Last I checked, air is lighter than solid. So you can see here are all the cavities of the skull. So we're looking at a nice coronal plane here. We cut through, and you can see this, the largest cavity is right up here, and that's where the brain sits. But here are your paranasal sinuses all on either side here of your nose. Okay, and then you can see these maxillary sinuses. These guys will give a fit, especially if you get a sinus infection. They're a real pain, no pun intended, legitimately. All right, so what I want to do is I want to go through and go over some of the views here of the skull. We're going to start off with the anterior view. I'm going to talk about what you can see, all right, in these views. So when you're looking at the anterior view, that's the anterior view right there. So when we're looking at the anterior view, you're going to have a nice picture of the frontal bone. That's a single unpaired bone that makes up the front of your forehead. And it goes all the way up past your hairline, pretty much to the top of your head here. So also we'll see, obviously, some of the cavities here, the orbital cavities, right, opening to your nasal cavity, right, the maxillary bone, right, your teeth and your jaw. All right, so we're going to see quite a few. Now, when we look inside the orbits, you're going to see these two slit-like structures. And they're a slit-like structure, so it only makes sense that we call them a fissure, because what's a fissure? It's a crack. So you'll have one that's on the top portion of the orbit, which is the superior orbital fissure, and then the one right below it is the inferior orbital fissure. Now, above the orbit, all right, where your eyebrows sit, okay, you have these structures called the superciliary arches. All right, now in males, ours are more pronounced. Right here. Folks with trisomy 21, they have a description of their superciliary arches, and they call it frontal bossing. So they'll have an even more pronounced superciliary arch above their eyes. And it's just one of the ways that we're able to recognize trisomy 21, also known as Down syndrome. Okay. Here you can see our fissures here. Here's the superior orbital fissure, this crack, all right, in the eye, and then down below is the inferior orbital fissure. So we'll see structures running in and out of those. All right, also in the anterior view of the skull, you'll see the nasal bones. That makes the bridge of your nose. Okay, your nose is made up of skin, cartilage, connective tissue, and bone. All right, so the most anterior bone of your nose is going to be the nasal bones. They're paired bones. You have a left and a right nasal bone. And then this area above the nasal bones is called the glabella. Then below your nasal cavity and on either side, and to make up the lateral portions of your nasal cavity or parts of it, is the maxilla, also known as the maxillary bones. So it's basically going to form your upper jaw. It's going to form the actual roof of your mouth, or part of the roof of your mouth, but it'll also form the floor, all right, or part of the floor of your eyes, of the orbits there. All right, let me show you. It's easy to see it. Okay, so here's the maxilla, this bone right here. Okay, so you can see it makes up the upper jaw there. All right, but you can see here it makes up part of the floor of the orbit on either side. and then it makes up the lateral boundaries to part of your nasal cavity here. And then it makes up the floor or the roof of your mouth. You can't see it. There's another view that you'll be able to see it. Here are the nasal bones, paired bones, sit right here on the bridge of your nose, and then just right above it, there's the glabella. Here's the frontal bone right here. Superior orbital fissure, inferior orbital fissure. All right, also on the anterior view, you'll be able to see the bony nasal septum. The bony nasal septum is going to be the structure that runs perpendicular, divides your nasal cavity into right and left portions. And so there's two bones that make up the bony nasal septum. We'll talk about that in a second. The perpendicular plate of the ethmoid bone and the vomer. All right, we'll talk about that in a second. On the lateral portion of your nasal cavity, you'll see these bones that look like, the best way to describe them is like scrolls, just they're wrapped up. And they sit on either side, all right, of the septum, right here. And so those are called the inferior nasal concha. Now their job is to help disrupt airflow in a good way. They swirl air around because when you're breathing air in through your nose, okay, you don't want to breathe in dry air. All right, you don't want to breathe in dry air. So when you're breathing air in through your nose, that process helps to humidify the air. So it doesn't, and it helps to clean the air. And these bones help to do that. All right, so here you can see your bony nasal septum right in the center. Okay, your nasal septum is made up more than just bone. It's also made up of cartilage. Okay, but you're not going to see any cartilaginous structures on our skull. Okay, so and we'll break it down. There's two bones that make up this structure here. To either side, here and here, these little projections, right, they sit in the lateral portion of the nasal cavity. These are called the inferior nasal concha. Here you can see the bone nasal septum a little bit better, and then the inferior concha, nasal concha on either side, here and here. All right, the next view I want to look at the skull is going to be the superior view, looking down. Real easy. Superior view is pretty simple because it's going to show us the four cranial bones, all right, the frontal, the two parietal, because you have a left and right parietal, and then you have the occipital in the back portion or the posterior portion. And then where the bones come together to articulate, all right, the joint that they create is called a suture joint. We'll learn about the different types of joints later on. All right, so you have two sutures. You have the coronal suture, which is going to be found between the frontal and the two parietal bones. And then you have the sagittal suture, and that's that suture that runs down from front to back, down the middle of your skull, that divides your left and right parietal bones from one another. So here you can see, here's the frontal bone. Here are your two parietal bones, left and right parietal bones. Here's the occipital bone. So you can see this suture that divides the frontal from the two parietals, that's your coronal suture. Then this suture here that divides your two parietal bones from one another, that's the sagittal suture. And then this suture way back here, I got a better view to show you. That's called the lambdoid suture. That's going to divide the two parietal bones from the occipital bone. Okay, so you do have to know three sutures. I'll go through the identification slides. We'll probably do a little bit of identification today. All right, so here you can see, all right, in our drawing, the frontal bone, left and right parietal bones, the occipital bone back here. With the coronal suture, our sagittal suture, and then our lambdoid suture here. All right, another view that we're going to look at is the posterior view. All right, so from the posterior view, we're going to see predominantly the occipital bone. We'll also see the parietal, left and right parietal bones, and then the temporal bones. The temporal bones are pretty much the bones that sit underneath your ears. Your ears lay right on top of your temporal bones. So we'll see the lambdoid suture. We'll also see the sagittal suture coming back from the frontal bone there. Okay. And there's a couple structures that you're going to see. Okay, the external occipital protuberance, if you reach around and touch the back of your head, you'll notice a little bump there. That's the external occipital protuberance. Protuberance is a bump on a bone. External because it's on the outside. Believe it or not, you have an internal occipital protuberance. You don't need to know that for our tests, right? But that's why we've called this one the external, because it's on the outside. The superior and inferior nuchal lines, you don't need to know that for the lab for the identification, but just know that these lines here are going to sit on either side of the external occipital protuberance. And they're just attachment sites for the ligamentum nuchae, which is this ligament that sits on the back portion of your neck, and some other soft tissues that they attach onto. So here, this bump, that's the external occipital protuberance, and then you'll see these lines off to the side. Those will be your nuchal lines. But here's a nice posterior view. You can see the left and right parietal bones. Here's your occipital bone, front and center for us. And then just off to the side here, these are the temporal bones over here. And you can see the lambdoid suture, and then you can see the sagittal suture. All right, so here, much better picture. Okay, there's our lambdoid suture. Here's the external occipital protuberance, and then you can see some nuchal lines here. You have superior and inferior nuchal lines. And again, that's where this ligamentum nuchae will attach onto the nuchal line. Again, you don't need to know the ligamentum nuchae. All right, the lateral view for our skull. Okay, this is where we're going to see one of our parietal bones, the temporal bone, and the new bone, the zygomatic bone. Zygomatic bone makes up part of your cheek. We'll also see the maxilla, which was that bone that makes up the upper portion of your jaw, half of your mandible, half of your frontal bone, and part of the occipital bone. But what we'll see nicely is going to be the lacrimal bone. The lacrimal bone has to do with the eye because you have a lacrimal gland. So we're going to see the lacrimal bone on the medial portion of your orbit. All right, we're also going to see this structure called the zygomatic arch. Like I said, makes up part of your cheek. All right, but you'll see it. The zygomatic arch is made up of two bones, the zygomatic bone and the temporal bone. And then we're going to see a famous structure called the temporal mandibular joint, also known as the TMJ. So some of you may have heard of the term TMJ. And TMJ is I guess you call it a slang term for the temporal mandibular joint dysfunction. People are like, oh, I got TMJ, you know, my jaw clicks, or I get pain right around that joint there. All right. So basically what they're referring to is where your jaw articulates with your skull. So here we can see on the lateral view, here's the temporal bone. All right, up here is your parietal bone. Here's your frontal bone. And then you've got your occipital bone back here. So some new bones that we're seeing. Here is the zygomatic bone, makes up part of your cheek. And then if we're looking at the orbit here, you can see this is the lacrimal bone. Now, from a lateral view here, I do want to point out something. All right, so this bone right here, this is one of your nasal bones. Remember, they're the most anterior bone for your nose. That's the nasal bone. This bone right here is the maxillary bone or the maxilla. So it comes down and goes here. Okay, so it comes down and goes this way and then forward. So then just behind or posterior to the maxilla is the lacrimal bone right here. So the frontal bone's up here. So just to kind of give you a little bit of perspective and a little hint too, when you're trying to learn this stuff, all right, start with this. learn all the bones first, then worry about the landmarks on the bones. Because we're going to talk about these different landmarks. You just heard me talk about the external occipital protuberance, and that external occipital protuberance sits on the occipital bone. I would say before you learn about the external occipital protuberance, learn that that bone is the occipital bone. And then you can start worrying about the structures. I can promise you this, a good number of test questions when you're taking the lab exam, the second lab exam, right, a good number of those test questions will ask you to identify the bone. Right? When I make my tests, a good number of my test questions say, name the bone. And people will name the structure on the bone. And that's not what I'm asking for. So learn the bones first, then you can learn the landmarks. You'll do better. Trust me. All right, so here's the zygomatic bone. And then this guy right here, that's your mandible, the jaw. Okay, so this next structure that you can see highlighted here in blue is the zygomatic arch. Now, the zygomatic arch is made up of two bones. So let's zoom in here. Here's your temporal bone. You can see here's the suture line. So here's the temporal bone. And the temporal bone has this projection coming off of it. It's going towards the eye. So this whole structure here is the zygomatic arch. Look, see the zygomatic arch? It pretty much goes from here to here. It's an arch. You can see it. All right, the zygomatic arch is made up of two bones. Two bones. I'm raising two of my fingers up to nobody because you can't see me. All right, it's made up of two bones. The temporal bone back here and the zygomatic bone here. So when we want to talk about a specific part of the zygomatic arch, if I want to talk about this area of the zygomatic arch, come down here. So if I want to talk about this area of the zygomatic arch, then what I would say to describe it is I would call it the temporal process of the zygomatic bone. Meaning, here's the zygomatic bone, but this part of the zygomatic bone that articulates or connects to the temporal bone here, this little part here is called the temporal process. The process is always named after, when we're talking about the zygomatic arch, it's always named after the bone to which it articulates with. Because we wouldn't call it the zygomatic process of the zygomatic bone. It doesn't make sense. So we're naming this part of the zygomatic bone the temporal process. So when we're talking about this part of the zygomatic arch, right, it's part of the temporal bone. So here's temporal bone. And so what is it articulating or connecting to? It's connecting to the zygomatic bone. So this portion of the temporal bone we call the zygomatic process. The zygomatic process of the temporal bone. All right, we'll go over it more and more, okay? But I figured I'd mention that now. All right, still on the lateral view here, when we're looking at certain landmarks of the skull, we'll notice there's a flat area of the temporal bone. And guess what else is flat? Squamous cells, okay? So that flattened area of the temporal bone, we call that the squamous part of the temporal bone. But just above that, okay, is going to be the squamous suture. All right, so here is the temporal bone, and this flattened portion is the squamous part. This should not be on here because that is not the squamous part. Okay, forget about this part, it's just this flat area here. And just above it up here, that's the squamous suture. Squamous suture is found between the parietal bone and the temporal bone. All right, we'll also see the external acoustic meatus. And so this is going to be the opening to your external ear canal. And then you're going to see this bump on the temporal bone right behind your ear. If you feel behind your ear and go down, if you're wearing glasses, it's where your glasses hook behind your ear, you'll feel this bump right behind your ear. That's known as the mastoid process. All right, so here's the opening. This opening here, that's the external acoustic meatus. And then this bump down here, that's the mastoid process. All right, I think what I'm going to do is I'm going to do a little bit of labeling here because yeah, I'm going to stop here and let's do some labeling because I know your brains need a rest. And I'm sure that some of you have already tuned me out anyways. So let me just pull up. All right, let's do a little bit of labeling here, take our minds off some things, and then we'll call it a night. All right, so if you have your atlas, pull it out, open it up, all right, to where the skeleton is, and let's start going through some labels here. And the nice thing is, as we move through some of this lab material, all right, I am going to do a review of a lot of these slides and bones, all right. What's today? Tuesday, either Thursday or Tuesday or Thursday of next week. Okay, so you'll see this stuff again. All right, repetition. All right, so here's the frontal bone. Okay, that's going to be the bone there that makes up your forehead, and that flattened portion there is called the frontal squama, and that's pretty much your forehead. The frontal squama is going to be the exposed part. Your hairline, all right, will be somewhere up here. All right, so here you can see the frontal squama. It's that flattened portion of the skull, of the frontal bone right here in the front. All right, that's the frontal squama. And then above your orbits, okay, you have these ridges here called the supra. Supra means above, so supraorbital, above the orbit, supraorbital margin, where those dashed lines are, essentially where your eyebrows are going to sit. And here you can see the supraorbital margin on this model. All right. Then you'll notice on our model here, there's a little notch. Here's the thing, and this is where you have to be really specific. A notch is an incomplete circle. All right. Now, stay with me here, okay? So if you see an incomplete circle, or looks like someone just took a bite out of something, okay? That's a notch. Again, since it's above the orbit, we call it the supraorbital notch. And you can see one over here. It's not as well defined, but still. And so notches, that's an area where there's going to be either nerves or blood vessels that run through that. So you can see it a little bit better here. Supraorbital notch. Now, if you notice, if you look over here to the left side of our screen, you've got a hole. It's a rounded hole. That's not a notch. There's another name for that structure, which we're going to talk about in a second. I just don't want you to confuse the two. Okay? Notch is just like a small, bite out of something. And now the other structure is called the supraorbital foramen. That is a rounded hole in the bone. Again, it's going to be for either nerves or blood vessels to pass through. And we call it the supraorbital foramen because it's above the orbit, above the eye. Don't confuse those real quick. Notch, foramen. notch, foramen. Please don't confuse those two. All right. So moving on to our next bone is the parietal bone. You have two of these. You have a left parietal bone and a right parietal bone. They make up the superior lateral bones of your skull. They sit just behind your frontal bone and superior to your temporal bone. Here on our colored skull, you can see it nicely. That's the green bone. So up here in the front, this is the frontal bone right up here. So we just saw that. So the parietal bone is going to be posterior to the frontal bone. All right, this bone right here, that's the temporal bone. So it's superior to the temporal bone. And here you can see it on this model. So it's kind of tough to see, but there's your parietal bone. Nothing really exciting about the parietal bone, all right? So then posterior on our model is going to be that blue bone. That's the occipital bone. It's an unpaired bone. You only have one. That makes up the posterior portion of your skull. So it's posterior to the temporal bone, posterior to the parietal bone. And it makes up a decent amount of the inferior portion of the skull, or the floor to the skull there. Here you can see the occipital bone on the posterior view here. All right, and then you can see it here on the lateral view. All right, that's the occipital bone. A couple structures here. If you notice, this is an inferior view of the occipital bone. We're still on the occipital bone. One of my favorite structures. It's called the foramen magnum. It's a big opening in the occipital bone. This is where your spinal cord is going to pass out of your skull. And it's going to pass out of the skull and go down into the vertebral canal, or into your spine. That's the foramen magnum. Foramen, rounded hole in a bone. And it's a pretty big one, so we call it magnum because magnum means large. Foramen magnum. On either side of the foramen magnum, we have these rounded structures. Those are called the occipital condyles. A condyle is a smooth, rounded structure like that. And it's smooth because what did we say? That means that the bone is going to articulate with another bone. And these occipital condyles are going to articulate with your first vertebra or first bone in your neck. It's called the atlas, or C1. Okay, so the occipital condyles are lateral. They sit on either side of the foramen magnum. Here's a little bit of a better view here. We'll zoom in. Notice how they're nice and smooth and they're not rough. All right, on the external part of the occipital bone, on our posterior view, that little bump coming off of the bone, that's referred to as the external occipital protuberance. External occipital protuberance. All right, the next bone on our skull is going to be the temporal bone that sits on the lateral portion here. You can see it's the brown bone here on our colored skull. And there's going to be a couple landmarks, some pretty unique features or landmark features to this bone. We're going to go through some of those. Here's the temporal bone. Here it is on our non-colored skull in this model. And here you can see it all by itself. So that's what the temporal bone looks like when it's removed from the skull. So this flattened area there, okay, we're not including this part here. No, it's just the flattened area. That is the squamous part. Okay, squamous part of the temporal bone. And now what we've done is we've just taken the temporal bone and we've flipped it over. So we're looking at it from the inside. So on the inside, we've got this structure right here, and that's known as the petrous part or petrous portion of the temporal bone. And basically your ear canal, your external ear canal resides in that region there, in that structure. Petrous part or petrous portion. All right, and you can see it here on the inside of the skull. So here and here. Petrous part or petrous portion of the temporal bone. So you can see all these sinuses up here. This model's got some good sinuses. Whoa, what's going on there? All right, so those sinuses again create air spaces, makes the skull lighter. It's awfully nice. All right, now we're back onto the outside of the temporal bone, and you notice this little hole here, or opening, right here. That's the external auditory meatus. Auditory having to do with your ear. Meatus, again, is an opening in a bone, and the external, obviously, is on the outside. So this is the external auditory meatus. All right, and then so just posterior to that or behind that is the mastoid. It's the mastoid process. And that's this bump that you'll feel behind your ear. All right, so that's this guy right here. That's the mastoid process. All right, and then you'll notice this other process, it's a little bit smaller, and it looks like a little pen tip or whatever. That's called the styloid process. Back in the day when PDFs, no, what are they? I'm trying to remember what they were called. Before smartphones came out, you had these little personal electronic assistant things, like a BlackBerry, but it didn't have the phone thing. I forgot what they called them. I'm hoping someone's coming to rescue me. Stylus. Oh, yeah. But it was the thing. Some of these little electronic devices came with the little stylus. It's like little thing that you would tap on the screen with. And so that's where this name came from, not from the electronic part, but styluses. All right, and that's called the styloid process. And it's a site for muscular attachment there. All right, then just in front of the external auditory meatus, you've got this depression in the bone. And we call that the mandibular fossa. And the mandibular fossa is going to be where our temporal mandibular joint is formed. That's where the mandible, your jaw, is going to articulate with the temporal bone and form one of the joints for your jaw. You can see it here a little bit better. See how where the jaw articulates, this whole area, that makes up your TMJ, temporal mandibular joint. Don't call it that. Call it the temporal mandibular joint. All right, so that depression there is the mandibular fossa. All right, there you can see it on that model. All right, and then you notice this one projection of bone that comes off. We talked about this when we were talking about the zygomatic arch. Right, so this is the temporal bone's contribution to the zygomatic arch. So that part of the arch we refer to as the zygomatic process of the temporal bone. Zygomatic process of the temporal bone. And so here you can see it. It's hard to see the suture line, but this is where the zygomatic process of the temporal bone articulates with the zygomatic bone. This is the zygomatic bone here. So this whole area, that's the zygomatic process of the temporal bone. All right, and then there's the zygomatic arch. So if you're on a test, you see an oval circle in this area of the skull, all right, you should know right away that that's the zygomatic arch. All right, now we're going to flip the skull, look at it from the inferior view here. All right, and you'll notice, all right, these two arrows pointing to the hole. All right, that is the jugular foramen. This is where the internal jugular vein starts. Remember, veins bring blood to the heart. So the jugular foramen is where our internal jugular vein forms as it's draining blood from the skull here. You have two. So here where I'm placing the X, that's the foramen magnum. Then you've got an occipital condyle here and here. So just lateral to the occipital condyles is the jugular foramen. Then just anterior to the jugular foramen, we have this other structure called the carotid canal. And the carotid canal is where your internal carotid artery enters into your skull to supply your internal structures of the skull, namely the brain, with 80% of its blood supply. So you have a right and left internal carotid artery. The right carotid artery carries 40% of the brain blood to the brain, and then the right internal carotid artery carries the other 40%. That's 80% of the brain's blood supply comes from the internal carotids that enter into the skull through the carotid canals. One more time, in case you forgot, that's the zygomatic process. There it is again. There it is again. Zygomatic arch. All right. I'm going to stop here. Just to give you folks a little bit of a break, because I know you got tests coming up. You also have, in case you haven't